Welcome to our comprehensive guide on naturally easing hip pain, specifically tailored for seniors managing hip osteoarthritis, a condition that affects millions of older adults by causing joint inflammation, stiffness, and discomfort during everyday movements like walking or climbing stairs. Maintaining your mobility is absolutely crucial, not just for physical health, but for preserving your cherished independence, allowing you to continue enjoying hobbies, spending quality time with grandchildren, and handling daily chores without constant pain interrupting your life. We're excited to demonstrate how these simple, equipment-free stretches and exercises can lead to noticeable relief and improved hip function over time. Let's start with our first stretch, gentle hip rotations, which are perfect for mobilizing the hip joint softly and safely, promoting better internal and external rotation to combat the stiffness typical in osteoarthritis. Lie down on your back on a comfortable surface like a yoga mat. Bend your knees comfortably. Place your feet flat on the floor hip-width apart to provide a stable base. And make sure to keep your spine in a neutral position while lightly engaging your core muscles to support your lower back throughout the movement. Now, take a deep breath in, and as you exhale slowly, allow both of your knees to fall gently towards one side, say to the right, feeling a mild mobilization in your hips without forcing the motion. Then, inhale as you guide them back to the center position smoothly. Repeat the same controlled movement to the left side, keeping everything pain-free and fluid, as this gentle rotation helps lubricate the hip joint, enhances range of motion, and reduces that tight, achy feeling many seniors experience first thing in the morning. Aim to perform 10 full repetitions on each side, moving at a slow, deliberate pace, about 3 to 4 seconds per side, to ensure smooth, controlled motion that prioritizes quality over speed, and always stop if you feel any sharp pain. Consistency with this stretch, even just a few minutes daily, is the key to achieving long-term relief, building cumulative benefits for your hip health that you'll notice in improved walking comfort and reduced daily stiffness. Moving on to our second stretch, the knee-to-chest position, which targets hip flexion and eases lower back tension often linked to hip osteoarthritis. Start by lying flat on your back with both legs fully extended straight out, arms relaxed by your sides. Then slowly bend one knee and draw it towards your chest, clasping your hands gently behind your thigh or on your shin to assist without straining. Hold this knee-to-chest embrace for a full 20 to 30 seconds, breathing deeply and steadily to relax into the gentle stretch you'll feel through your hip and into the lower back, promoting better flexibility and blood flow to the area. After releasing slowly, straighten that leg and switch to the other side, repeating the hold to balance both hips. This stretch is particularly helpful for loosening tightness accumulated from prolonged sitting, a common issue for many seniors. Throughout, never pull too aggressively. The sensation should always remain comfortable and mild, never crossing into pain territory, as gentle persistence yields the best results without risk of aggravation. Plan for 2 to 3 repetitions per leg, taking your time with transitions to maintain control and maximize the therapeutic benefits for your arthritic hips. Next up is the seated butterfly stretch, an excellent seated option that's accessible even if getting down to the floor feels challenging some days, focusing on opening the inner hips and thighs. Sit upright on the floor or a firm chair with the soles of both feet pressed together in front of you, letting your knees bend naturally outwards like the wings of a butterfly, keeping your spine tall and shoulders relaxed. From here, inhale deeply. Then as you exhale, gently encourage your knees to drop closer towards the floor using gravity or light pressure from your elbows if needed, while placing your hands on your ankles or feet for added support, savoring the deepening stretch in your inner thighs and hip groins. This position specifically targets the adductor muscles around the hips, which often tighten with age and osteoarthritis, helping restore flexibility for easier leg movements. Maintain this butterfly hold for at least 30 seconds, continuing those slow, deep breaths to enhance relaxation and stretch effectiveness, making it a go-to for increasing overall hip flexibility and significantly cutting down on that stubborn morning stiffness many seniors battle. Repeat the hold 2 to 3 times if comfortable, building endurance in your hips gradually. Transitioning to strengthening with side-lying leg lifts. designed to build up your hip abductor muscles that stabilize the pelvis and prevent painful swaying while walking. Lie comfortably on your side atop a mat, with your bottom leg slightly bent at the knee for solid stability, while extending your top leg straight out, toes pointing forward, and aligning your hips stacked vertically. Engage your core lightly, then slowly raise your top leg towards the ceiling as high as feels comfortable without letting your hip roll backward. Aim for a height where you feel the outer hip working steadily, keeping the movement smooth and toes flexed or pointed as preferred. This controlled lift isolates the gluteus medius, a key muscle for hip support in osteoarthritis sufferers, improving balance and reducing fall risk. Lower the leg back down with equal control, avoiding any quick drops, and repeat for 10 to 15 repetitions per side, resting briefly if needed between sets to keep form perfect. Regular practice strengthens the hip-supporting muscles, leading to better joint stability and less pain during standing or walking activities. Now for the bridge pose, a fantastic exercise to activate and strengthen your glute muscles, which play a vital role in hip stability and power for seniors with osteoarthritis. Begin lying on your back, knees bent at about 90 degrees, feet flat on the floor hip-width apart, and arms resting comfortably by your sides with palms down. Take a breath. Engage your core and squeeze your glutes firmly. Then lift your hips upward steadily until your body creates a straight line from your shoulders through your hips to your knees, holding that alignment without overarching your back. This peak contraction powerfully targets the glutes and hamstrings, essential for supporting the hip joint and countering weakness from inactivity. Pause at the top for 3 to 5 seconds to intensify the glute work, then lower your hips down slowly and controlled, repeating the full bridge for 10 to 12 times to build strength progressively. Strong glutes are crucial for hip stability, helping prevent pain flare-ups and supporting better posture throughout your day. Wrapping up the exercises with the standing hip flexor stretch, ideal for countering tightness from sitting, which exacerbates hip osteoarthritis symptoms. Stand tall with feet hip-width apart. Place one foot slightly forward, then shift your weight to gently lunge into that front leg, while keeping your back leg straight and torso upright. As you settle into the lunge, you should feel a pleasant stretch across the front of the hip in your back leg, right where the flexors attach. Hold steadily for 20 to 30 seconds while breathing evenly, then switch legs to balance the stretch. This targets the often overlooked hip flexors, relieving anterior tightness that pulls on the joint and contributes to pain. Keep your core engaged throughout to protect your lower back from arching, maintaining that tall posture, and aim for 2 to 3 holds per side, moving mindfully to avoid any wobbling. Proper form here ensures maximum benefit with minimal strain on your arthritic hips. In addition to these stretches and exercises, smart pain management strategies can amplify your relief. For acute pain or swelling after activity, apply an ice pack wrapped in a cloth for 15 to 20 minutes to numb soreness and reduce inflammation effectively. Switch to moist heat, like a warm towel or heating pad on low, for chronic stiffness, as it boosts blood flow, relaxes muscles, and eases that deep joint ache before exercising. Research from various studies, including those on natural anti-inflammatories, indicates that turmeric supplements, thanks to their potent curcumin content, may help lower inflammation markers in osteoarthritis. Typical doses are 500 milligrams twice daily with black pepper for absorption, but always consult your doctor first to ensure it fits your medications and health profile safely. While these natural methods prove highly effective for most seniors, recognize when professional intervention might be next. If hip pain severely limits daily activities like dressing, shopping, or sleeping despite your consistent routine, have an open discussion with your doctor about options, including hip replacement surgery, which has high success rates for restoring mobility. To stay on top of your progress, regularly track your pain levels on a 1 to 10 scale and note mobility improvements each week in a simple journal or app, sharing this valuable data with your healthcare provider to fine-tune your plan and celebrate gains. Your proactive journey to better hip health and pain-free movement starts right now. Commit today for lasting results tomorrow.